Hello, this is Dr. David Greene, CEO of the California Pain Network. The topic today is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It's very different in adults than it is in pediatric kids. It's often painful, it's stiff, and it's not responsive to bracing, like pediatric scoliosis, and it often causes both back and leg pain. Okay, so in kids, it's usually very flexible, responsive to a brace. It's not typically very painful, so it is extremely different. Why does it occur? Well, there's a few reasons that we know of. One is if you've had pediatric scoliosis and it was over 40 degrees when you became what's known as skeletally mature, okay, then usually it can get worse at an average rate of 1 degree per year. That doesn't sound like much, right? But if let's say you're at 40 degrees and you're 15 years old, or let's say 20 years old, and then 40 years go by the time you're 60, that curve could be 80 degrees. Okay? So it does add up. The other one is if it can occur new due to spinal degeneration. So you had no pediatric scoliosis, you start having spinal degeneration. It starts in the disc. Okay? You get degeneration of the disc. It shifts stresses back to the joints in the back of the spine abnormally, and you can get arthritis asymmetrically, one side worse than the other, and you can start to get a curve. And when that happens, nerves get pinched on the concave side of the curve, right? Because think about it, you have less room for those nerves to get out because the joints are closer together. What are the symptoms of adult scoliosis? Well, the arthritis in the facet joints, those small joints in the back of the spine, can lead to significant back pain. Patients may also get muscle weakness and aching from difficulty standing up straight due to the arthritis, and you may also get buttock and leg pain from spinal stenosis. So here's scoliosis in an adult, okay? You can see this is the concave side of the curve, and you can see all these extra bone growth here from the arthritis. Well, the nerves that are trying to get out here have much less space, so they can get pain called spinal stenosis down on the left side of the buttock and into the thigh. What are the treatments for adult scoliosis? Well, I can tell you right now that over 85% of patients with adult scoliosis will not need surgery. Okay? This could range from over-the-counter medications such as Advil and Tylenol to prescription medications such as higher-strength nonsteroidals, neuropathic medications such as Neurontin, narcotics, or topical medications. Physical therapy and chiropractic treatment may help, and then there's interventional treatments, which we'll talk about right now. You can have arthritis in these facet joints, okay? So an injection of cortisone into those facet joints may help tremendously along with some numbing medicine, and that can stick around and provide pain relief for weeks to months. If you're having muscle spasms as well, then trigger point injections may help. A couple additional treatments. This is called a medial branch block. Instead of putting a needle into the facet joint that's arthritic, you actually put the needle around it and inject the numbing medicine and steroid, and that can give pain relief because it can numb up these little nerve endings that provide sensation to the joint. If that works and then wears off, you can undergo a radiofrequency ablation, which involves this probe in the same area, but instead of cortisone, you heat it up, and thermal energy deadens those nerves, and that can give pain relief for well over a year. Okay? Epidural injections for the spinal stenosis can work well for the pinched nerves, and those can be given as a series of injections, 3 over 6 weeks, and then that can be repeated every few months. So the outcomes with non-operative treatment, over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Okay? Between the treatments for back and leg pain, most patients do not end up needing surgery. It's an elective, quality of life decision and should definitely be a last resort. Surgery may involve a stem to stern decompression and fusion. You see all the screws here, and the sacrum screws, and the inner body fusion. It's a big procedure, okay? And adults simply do not tolerate surgery like you do when we're kids. So the complication rates are very high. It's over 50%. California Pain Network offers the top non-operative pain management in the state, with multiple affiliated clinics throughout the state, including San Diego, Oceanside, Orange County, LA, Inland Empire, Bakersfield, all the way up to San Francisco. The clinics accept over 50 insurances, and over 25 treatment options are provided, with over 90% overall success rates for achieving pain relief and helping patients avoid surgery. The doctors are board certified and award winning, so call us today at 877-877-8556 and visit us online at californiapainnetwork.com. I'm Dr. David Greene with the California Pain Network. Your pain stops here.